Following extractions, Elina will perform a salicylic acid peel and neutralization.
Now, her skin is clean and we're ready for salicylic acid treatment. We need it because salicylic acid is very anti-inflammatory. I have natural salicylic acid, and we will make approximately between 30 to 50% shrink for acne people. So you will make your judgment based on skin. But before we pre-mixing any salicylic acid, first of all, we'll create neutralization solution, which we will use baking soda and water. And this needs to be pre-mixed before we apply the acid, because acid needs to be neutralized and we don't want to be unprepared for that. Lots of people have a problem to calculate percentage, so I will show you the easy way. If you do half and half, and otherwise 50, that's 50-50, using salicylic acid and my oil control, you're getting 50% strong acid. You don't want to start with 50% if you're first time doing it. So if you will dilute it second time, it will make it 25, which sounds less strong and easier to work with. I will mix oil control formula with salicylic acid. Remember, salicylic acid doesn't dissolve in the water, so it needs to be premixed only in special base. And I will apply first that solution on most problem areas, less sensitive areas. You have to apply it pretty quickly, and you need to make sure it's not runny. So we don't want to acid to get into the eye. We'll hold it for a few seconds on the most problem areas, and then we will cover entire face. And we wouldn't have to cover some areas around the eyes or areas which not require extra exfoliation. Be very careful on the sides of the nose, because it's a very sensitive zone, and we starting neutralization of the acid from that area first. How do you feel, Vicky?
Skinny.
Okay. How much is it tingling from 0 to 10?
Like a 6.
6. I think, do you feel like you're ready to remove the acid? Yeah?
Yeah.
Yeah, okay. We want to make sure, again, it's not too runny solution of water and baking soda. And lots of estheticians like to cover eyes with iPad. I don't cover eyes with iPad just because I want to see what's going around the eyes, but it's very individual way of doing it, so please feel free to cover the eye area if you like it. First of all, I'm removing the acid, neutralizing the acid on the most sensitive areas, and still keeping it on less sensitive areas. Remember, stronger the percentage of the acid, shorter the application time. Literally, we don't need to hold salicylic acid longer than 30 seconds.
Use cold laser for 5 minutes. If it is not available, use high frequency for 2 minutes. After the skin gets dry, you can proceed with microdermabrasion. If it is not available, you can exfoliate with honey granules mixed with healing formula.
Now you can take a look at the skin of your client, and we see she has acne vulgaris, lots of problem zones. So I wouldn't suggest you to use microdermabrasion. So to make a light, gentle exfoliation, we will use honey granules, especially honey, very detoxing, very cleansing, very nourishing. So I will mix right on my hand honey granules and with my healing formula. And I will slightly massage your face with that solution. And honey will melt right on the top of your skin, produce that wonderful honey mask. At the same time, before it's melted, she will experience a very mild, gentle exfoliation.
Now is the time for the treatment serum and anti-inflammatory mask, which Elina blends with her skin herbal tea. Most of Elina's masks and serums come in a powdered form and have to be pre-mixed before the application. Because of this, the highly concentrated organic compounds do not have to be preserved, and they are safe for deep transdermal penetration with ultrasound or other equipment. Certain protein-based masks should not be mixed with hot tea, but instead with lukewarm water. After the mask is ready, Elina applies it to the skin.
So I will use anti-inflammatory mask right on the top of honey granules because it will really produce synergetic effect. Because my masks are not transdermal, we just cooked them. So we will use some way of penetrate them deeper into the skin. You can use ultrasound, you can use galvanic. If you don't have that equipment, you still can use high frequency machine. But I will choose ultrasonic because I think it's one of the most effective ways to penetrate. Working with ultrasound, you need to remember it always needs to be moist, and how to see how it's working. Actually, it's enough to spray some liquid on it and you will see machine is working. And we're starting